One of the reasons why the Northeast London Imaging Academy has been established is to make sure there's a standard skills and procedure being done across Northeast London. The standardization is very crucial because it can be a life-changing moment for the doctors who are making decisions in terms of the treatment. I'll give you an example. MRI prostate. Everyone is being encouraged to do the multiparametric TIRAD MRI prostate technique. However, in Northeast London, sometimes we do it differently. Like in my hospital, we do MRI prostate using the TIRAD technique very religiously. However, when you go to other hospitals, sometimes they do a shortcut. Sometimes they don't give contrast, which has become a problem. Sometimes if you don't give contrast, the ability for the radiologist and the clinician to create a sound, informed decision is diminished. Simulation offers such a safe and controlled environment, which I find it crucial for MRI training. You know, in the ideal training environment, having a scanner for teaching is essential. However, with the limited scanner time, patient availability, educators face some real challenges. I find simulators interesting because simulators help connect classroom learning with the real-world clinical experience. It allows learners to apply their knowledge immediately, even without having a physical MRI scanner. When they scan, when they plan for scanning, they can make mistakes without even worrying about serious outcome. Like, you know, when you make a mistake, you have to call the patient back for another scan. Students have the chance to perform scans multiple times, which help them build the confidence they need for clinical setting. I've used several MRI simulators over the years. I found that each simulator has its pros and cons. Some are very focused on theory, while others provide technical details. ScanLabMR stood out to me because I was looking for a tool that is more realistic, more clinically relevant. I wanted to see if ScanLabMR could fix some problems I had with other simulators. Many platforms are too complicated to use. Learners are already stressed when trying to understand a new modality, which includes studying different cross-sectional anatomy, adjusting different parameters. They do not need extra confusion and more complicated technology. Some platform, you have to use F function, like F1, control F1, control F2. That's a bit too much for the students already. Another ongoing issue is that adjusting parameters often does not show a realistic image outcome. If you change the field of view or the matrix size in an MRI from 512 by 512 to 128 by 128, you get fewer pixels in the FOB. This results in a larger pixels, which can cause blurring or loss of small details. The challenge is to show learners this effect in real time so they can understand it better. In my experience, the simulator works well for showing how changes in input affect the results. For example, when you adjust the FOB matrix, you can see how it impacts the image quality. In terms of scan planning, if you're examining the lumbar spine and you miss the angle of the disc space, the simulator clearly reflects the anatomical mistake. It helps learners understand the scanning concept better. While no simulator can fully capture the complexity of real-life scanning, ScanLabMR does a good job of demonstrating that relationship. The ScanLabMR is designed for different skill level. Beginners can learn the basics through guided scanning exercises. Those more advanced learners can work on protocol manipulations and case-based learning. In our experience, when our students started reaching 10 or more scanning exercises, students are more likely to pass the quizzes and practical assessments. However, to keep the learning more engaging, I can adjust the level of the question difficulty and raise the grading standards for practical scans. I remember a session when learners had difficulty understanding proton density and how it is different from T1 and T2 weighting. It's quite easy to say that fluid looks bright in T2 weighting and dark in T1 weightings, whilst in proton density weighting, it appears gray. However, learners really improved when they could change the parameters in real time and see the results visually. This really helped them understand the concept of T1, T2, and PD better, making the theoretical topic feel more real. Well, I can really speak for myself because, I've used ScanLab so many times. This MRI simulator helps me plan training more effectively in our PgC-MR department. Since students have limited study leave and access to scanners for training is almost zero, I can easily integrate classroom lectures with practical scanning. This maximizes the time I have with students and speeds up their learning. I can even set up exercises, run assessments, and give feedback more easily. While this doesn't substitute for a time on the scanner, it makes clinical session more productive because when students come to the scanner, they come more prepared. I would say it's a valuable component of a blended learning strategy. It helped me support concept development. It encourages active learning. It offers a more realistic experience without even needing the physical scanner. This is something that works best for me. When ScanLab is integrated with other forms of teaching, like lectures, case discussion, and hands-on clinical practice, it really makes the learning more effective. The main findings from the case study show that learners value simulation-based MRI training, especially when it is closely resembling a real-time scanner. Features like ease of use, a more realistic MRI images, and immediate feedback can improve learning and help learners feel more prepared for the actual clinical practice. Well, what I can say is, based on the feedback with my students, they're quite happy having ScanLab as the MRI simulator. So I think we won't reinvent things. I definitely believe that simulation is here to stay. Simulations help enhance access. It helps the students and learners boost their confidence before they even do a proper clinical scanning. It supports learning in ways that are difficult to achieve with the traditional clinical or the use of an MRI scanner model. Regarding ScanLabMR, I believe that it will continue to evolve and play an important role in shaping the future of MRI education. I had a not so nice experience with other platform. When we reach the simulation stage, there's a very poor compliance. I wasn't very pleased with that. As students, when they sign up for the course and for the program, they agree that they should do X number of scans using the simulators. However, I think 1 out of 6, there's only 1 students who are using the platform. And when I ask them, they say that they don't like it. These students, they started doing some scans already. In other words, they have some experience already with a proper MRI scanner. So they know which one is more realistic. They know which one is close to being a real scanner. All of them mentioned that this type of simulator is not even close to being a real MRI scanner. So in the end, we just use that for other purposes because we subscribe already. We still make do with what we have.